Hypothyroidism or underactive thyroid. Hypothyroidism, also called underactive thyroid, is when your thyroid gland does not make enough thyroid hormone. The thyroid is a small butterfly-shaped gland situated at the base of neck. Hormones produced by the thyroid gland, triiodothyronine and thyroxine, have an enormous impact on your health, affecting all aspects of your metabolism. These hormones also influence the control of vital functions such as body temperature and heart rate. Thyroid hormones control the way the body uses energy, so they affect nearly every organ or every part of your body, even the heart, brain, muscles, and skin. When there is a deficiency in thyroid hormone, our body has trouble using energy and staying warm. Without enough thyroid hormones, many of our body's functions slow down. Hypothyroidism is more common in women. The most common thyroid disorders are autoimmune disorders where the body attacks its own tissue, in this case the thyroid gland. There are two types, Graves' disease or Hashimoto's thyroiditis. Graves' disease causes the thyroid to be overactive while Hashimoto's causes it to be underactive. Symptoms. The signs and symptoms of hypothyroidism vary depending on the severity of the hormone deficiency. Problems tend to develop slowly, often over a number of years. Hypothyroidism may not cause noticeable symptoms in the early stages. Over time, untreated hypothyroidism can cause a number of health problems such as obesity, joint pain, infertility, and heart disease. The most common are fatigue and intolerance to cold. Other symptoms are swelling of the thyroid gland or goiter, unexplained weight gain or difficulty losing weight, depression, muscle weakness, constipation, dry, thick, scaly skin, brittle nails, low pulse or blood pressure, puffiness in the face, especially around the eyes, excessive sleepiness, muscle cramps, high cholesterol levels, irregular menstrual cycle, decreased concentration, lethargy and headaches, cold hands and feet, dry, coarse hair, or hair loss is a common sign of a thyroid problem. Both too high or too low levels of thyroid hormones can lead to hair loss. The hair typically grows back once the condition is treated. Causes. Hypothyroidism has several causes including Hashimoto's disease, which is a chronic autoimmune condition in which the person's immune system attacks their own thyroid gland, causing hypothyroidism. It's more common in women than men and is the leading cause of underactive thyroid in the US. Thyroiditis or inflammation of thyroid causes stored thyroid hormone to leak out of your thyroid gland. Several types of thyroiditis can cause hyperthyroidism and then cause hypothyroidism. Family history of thyroid disease. Iodine deficiency, surgical removal of thyroid gland, Graves' disease, radiation treatment of the thyroid, radioactive iodine treatment, congenital hypothyroidism, use of certain medications, too little iodine in the diet, pregnancy, postpartum thyroiditis, pituitary gland and hypothalamus damage or disorder, and stress. Stress alone will not cause a thyroid disorder, but it can make the condition worse. Diagnosis. In general, your doctor may test for an underactive thyroid if you are feeling increasingly tired, have dry skin, constipation and weight gain, or have had previous thyroid problems or a goiter. Your doctor will take a medical history and do a physical exam, but also will need to do some tests to confirm a diagnosis of hypothyroidism. These may include thyroid stimulating hormone and T4 test. A low level of thyroxine and high level of TSH indicate an underactive thyroid. If your test results or physical exam of the thyroid are abnormal, your doctor may order a thyroid ultrasound or thyroid scan to check for nodules or inflammation. Treatment. If you have hypothyroidism, your doctor will prescribe a synthetic thyroid hormone T4. The medication not only restores adequate hormone levels but also helps manage the cholesterol levels that occur as a major symptom of the disease. The dose varies depending on the age, pregnancy status, and heart health of the patient. Treatment with levothyroxine will likely be lifelong. Doctor may recommend taking the medicine in the morning before eating. Hypothyroidism most likely can be completely controlled with thyroid hormone medicine as long as you take the recommended dose as instructed. Never stop taking your medicine without talking with your health care provider first. Make sure your doctor knows about all the medicines, herbs, and supplements you take, including over the counter products. Complications of hypothyroidism. Untreated hypothyroidism can lead to a number of health problems such as goiter, mental health issues, heart problems, joint pain, obesity, myxedema. Myxedema is the most severe form of hypothyroidism. A person with myxedema can lose consciousness or go into a coma. Peripheral neuropathy. Long-term uncontrolled hypothyroidism can cause damage to your peripheral nerves. These are the nerves that carry information from your brain and spinal cord to the rest of your body. For example, your arms and legs. Peripheral neuropathy may cause pain, numbness, and tingling in the affected areas. Infertility. Low levels of thyroid hormone can interfere with ovulation, which impairs fertility. Birth defects. Babies born to women with untreated thyroid disease may have a higher risk of birth defects compared to babies born to healthy mothers. These children are also more prone to serious intellectual and developmental problems. Thyroid problems in a pregnant woman can affect the developing baby. If the mother has hypothyroidism, the baby does not get enough thyroid hormone. This can lead to problems with mental development. What should I eat or avoid eating if I have hypothyroidism? Talk with members of your healthcare team about what foods you should limit or avoid and let them know if you take iodine supplements. Women need more iodine when they are pregnant because the baby gets iodine from the mother's diet. If you are pregnant, talk with your healthcare provider about how much iodine you need. Eat a healthy, balanced diet. Plan to eat 3 well-balanced meals full of fruits, vegetables, and protein each day. Morning breakfast should be low in sugar but high in protein and fiber. Consume seaweed, probiotics, and lots of fish and fruits. Avoid soya products. Consumption of soy may interfere with your ability to absorb thyroid medication. For that reason, you may want to wait 4 hours after eating soy-based foods before taking your regular dose. Avoid eating kelp, cabbage, cauliflower, and kale. They may interfere with the production of thyroid hormone. Avoid iron tablets, sugary, processed, and fatty foods such as butter, meat, and all fried things. Reducing alcohol, caffeine, and sugar in your diet will help with your overall energy levels. Vitamin D helps regulate calcium and phosphate production and is needed for healthy bones, teeth, and muscles. Some studies have shown that the people with low levels of vitamin D may also have thyroid disorders. Since most people may be deficient in vitamin D, the NHS advises that all adults and children over the age of 5 take a supplement of 10 microgram each day. Drink plenty of water. Exercise and relaxation. Taking time to reflect or meditate can help the body relax. In turn, relaxation leads to reduced stress and less impact on your thyroid.